Hi, everyone, and welcome to our second episode of Arthritis at Home. My name is Maya Joshi, and I'm the Program Coordinator at Arthritis Consumer Experts. Today, on Wellness Wednesdays, we are very excited to learn from Dr. Jackie Whittaker. She is a research scientist of Musculoskeletal Rehabilitation at Arthritis Research Canada, an assistant professor in the Department of Physical Therapy at the University of British Columbia. Dr. Whittaker completed her Bachelor of Physiotherapy degree at the University of Alberta and a PhD in Musculoskeletal Rehabilitation at the University of Southampton, and a post-doctoral fellowship supported by an Alberta Innovates Health Solutions Clinician Fellowship in Injury Prevention and Epidemiology at the University of Calgary. She has been an assistant professor at the Department of Physical Therapy and research director at the Glen Sather Sports Medicine Clinic at the University of Alberta. Thank you so much for joining us today, Jackie. And she will be covering caring for your joints during COVID-19.
Well, thanks for having me. I'm excited about this.
Of course. So you said that you would like to cover today the topic of caring for your joints during COVID-19. So of course, for many, it may be the reality that their normal physiotherapy clinics are closed. Maybe they don't have access to their local gym. So we were wondering if you could give some advice for people with OA of how they can keep progressing during this time.
Sure. Well, I think a couple things. Obviously, our normal routines have been completely disrupted. And I think that it probably depends a little bit where you're at with respect to your osteoarthritis or maybe even your knee injury. Some of my research focuses on knee injuries and some of it focuses on osteoarthritis. And as I'm sure many of our listeners will know, those two things are related. So I think number one, if you're not in a flare-up, then there's things you can be doing. And then I think that if you are having a flare-up or you're having some challenging times, then I think that's a different thing. So maybe I'll chat first just a little bit about those of us who are just dealing with our osteoarthritis or our knee injury. And we've got it fairly well under control, but we want to make sure that we don't let things slide over the next month or 2 months or 3 months. I think there's a couple things. I think number one, a lot of us probably have a little extra time in our hands. And one of the things that we could be doing is maybe spending a little bit more time learning about our condition. There's a lot of really good, trusted websites out there. And I know that you guys can point people to lots of good resources, and I can mention a few of them as well. But this is a great time if you've got questions about your condition to maybe do some online research and try to figure some things out. The key is obviously to stick with trusted sources. But there's really great ones out there. GLAD Canada, GLAD Australia, GLAD Denmark, the OASIS program, which is the Osteoarthritis Service and Integration System here in British Columbia, has some really great resources on their website. So that's one thing. I think the other thing is you've got to keep moving and you've got to find ways to move. And obviously, depending on where you live and what your living circumstances are and whether you're or not you're socially isolating. I mean, it's one thing if you're physically distancing because, of the recommendations from your government, but if you're actually having to quarantine yourself, that poses its own challenges as well. But there are a lot of opportunities for continuing to move. If you've got specific exercises that a therapist has maybe given you, you definitely want to make sure you've got time in your day when you're working on those and figure out if you need to modify them and et cetera. But I'd also say you need to do things like stay hydrated, eat well, get lots of sleep if you can do it. And I know there's a lot of stress involved. And I think our what is Mondays called? Hashtag Motivation Mondays. Our first Motivation Monday speaker was talking a bit about dealing with anxiety. So that might be something interesting for people to listen to. If you're having a flare-up, I think that raises another set of questions because you may have some skill set about how you might want to deal with that. But if you've got a lot of questions, I think it's really important for listeners to know that there's been some pretty dramatic changes in the way that physiotherapists are delivering physiotherapy in the last couple weeks. And in Canada, I know also in Australia and other parts of the world, there's been really big changes to legislation to allow us to be able to deliver physiotherapy in a telehealth setting. And in fact, some of the large insurers like Sun Life in Canada have come on board and are allowing for those consultations to happen in online forum. So, you know, I would reach out to your physiotherapist, give them a phone call, look at their website and see if that is something that they're offering. And perhaps you can schedule a short session, have a discussion about what's going on and get some feedback about what you can do. If your particular physio isn't offering those services, you can go, depending on where you live. So I know that the Canadian Physiotherapy Association has resources that you can access. So does the Physiotherapy Association of British Columbia. I'm sure a lot of other national organizations do as well. And we'll have links to therapists that might be delivering services over a telehealth sort of environment.
Right, great. Well, thank you. Those are all just such important resources and insight. Something I was wondering is you had said that some people may not be able to have access through telehealth to a physiotherapist. So for those individuals, do you think you could maybe talk about a few exercises that they could do from home during this time with OA?
Sure, I can definitely pick a few of my favorites. I think the big thing to say at the start of this conversation, though, is just because I've shown it here doesn't necessarily mean it's appropriate for you or it makes sense for you. I'm going to suggest a couple that I think most people could do, but it's really important to do it within the context of where you are with your body and your disease and what you're doing, and to really listen to your body when you do it. Typically what we tell people is if you sort of scan your body before you start to do an exercise and your pain is kind of falls in a 5 out of 10 or less. So 0 being no pain, 10 being the worst pain you can imagine. If you're sort of sitting at a 5 or lower, it's probably okay to go ahead and start exercising. If it goes up over that 5, you might want to consider backing off. It's also normal that when you do some exercises that your pain might start to go up. So maybe your pre-exercise pain is maybe a 2 or a 3 out of 10, but it might go up to that 5 out of 10 by the time you're done the exercise. That's okay. The big thing you want to pay attention to is whether 24 hours from now, it's back down to where it was when you started. So back down to say that 2 or 3 out of 10. And if that's the case, that you've done nothing wrong, there's no problem with the pain increasing a little bit. But if it's going above that 5 and it's staying above there for a longer period of time, then you might need to adapt some of the things that I'm going to quickly show so that they're maybe not as aggressive or aren't loading you as much. So because osteoarthritis, which is the area that I'm sort of the most knowledgeable in, typically affects the hips and the knees, I'm going to give a couple suggestions for things that people can do for lower extremity. Probably my 2 favorites would be a squat or a modified squat. So I'm going to quickly show you guys. So basically, it's pretty simple. I'm sure most people have done some form of this before. And basically, you can do it in a variety of ways. You could go as aggressive to just starting to sit right back down onto a chair and getting back up. It's a pretty functional exercise. You want to lower yourself slow and controlled. Don't drop into the chair. Actually try to control yourself on the way down, really reaching back with your bottom so that the first thing that touches is your bottom, and then leaning forward, putting your weight through your feet and pushing up and going completely straight. Now, depending on how well or how strong you are, you might want to increase the height of your chair so you don't have to go down as far. You might also do something where you just are kind of going up, down, and touching something that's a little bit of a higher surface so that you're not having to go as deep with the exercise if your muscles aren't as strong. The other exercise that works really well, and this is more for your glutes, for your butt muscles, and those are important both for hip and knee OA, is something we call a monster walk. And so basically all a monster walk is, and I'm sorry, I don't have, where I'm isolating, I don't have a piece of TheraBand, but you take some sort of a fitness band or TheraBand and tie it around your ankles, go into a little bit of a squat, not a lot, but a little bit, and then you can work on walking against that resistance and controlling the resistance in, walking against it and controlling it in. And you can work back and forth. So you can see the name sort of monster walk. That's kind of how it comes up. So basically you can work on it that way. So probably 2 big muscles you want to target are your quads and your glutes. So probably those are my 2 best suggestions, and hopefully 2 exercises that wouldn't really aggravate people too much. People might ask, well, how many do I do? Typically, I don't say it's about the number of sets and reps. I would do it till you start to feel a bit fatigued. So however many repetitions that is, and then take a break for 30 seconds, a minute, do it again, and maybe do that 3 times. You'll know that you're getting fatigued when you start to sort of feel that your muscles, maybe you're getting a little bit shaky. Maybe you're getting a little bit of a burn in the muscle. that would be an indication that you're starting to fatigue. If you start to feel that, do one more repetition, take a break, and then repeat that 3 times.
Great, thank you. You've answered every question that I would have as a patient listening to, how do I know when I feel fatigued? What can I do? So yeah, perfect. And one thing is, would you suggest that to be every day, or how often?
So I think that it probably, again, depends on where people are sort of in their process. So no problem with doing it every day. Also no problem with giving yourself a rest day. And I think that really depends on your strength and your current sort of situation. What I would probably do is fall back to that 24-hour rule that I was just talking about. Whereas before you start, kind of just go on a scale of 0 to 10, what's my pain? Let's say it's a 2. Do my exercise, my 3 sets to fatigue of my squats, 3 sets to fatigue of my monster walks. And then sort of just, okay, where's my pain level? Maybe it's gone up to 4, maybe it's gone up to 5. Okay, no big deal. 24 hours from now, set your phone, have it go off and go, what's my pain level? If it's back down to a 2 and, you know, there isn't an increased amount of pain in your hip joint or your knee joint, I don't think there's a problem with doing it again. If you go to fatigue, you know, you might find you can't do as many repetitions on the second day because you're still a bit fatigued for the first day. So pay attention to that. That's okay. And then if you're finding you're really doing a lot less repetitions because you're feeling that burn and that shaking really fast, well, then maybe the next day you give yourself a break and go back to it the day after that. So I think it's really about listening to your own body, listening to pain, knowing that a little bit of pain is okay as long as it goes back to where it was within 24 hours, and listening to your body as far as, you know, the shakiness of your muscles and the burning in your muscles. It also might be normal for you to feel a little bit of second day soreness. That's okay. And it's also okay to exercise again when you feel that secondary soreness, that second day soreness. But again, just really listening about pain and really listening about that shakiness and the burning that you get in the muscle.
Right. Do you have advice for how people can stay positive when they are in significant joint pain during this time of self-isolation?
Yeah, I mean, you know, I think it's interesting. I think that I think there's probably a lot of different types of pain going on. I think that, you know, we have the physical pain that we have from our osteoarthritis or we have from our knee injury. And it's really interesting how that pain can get exacerbated when we have other stressors, whether that be related to just not being able to communicate with the people that you want to communicate with, anxiety around becoming unwell, anxiety about, you know, obviously what's happening with work situations and stuff like that. And so I think it's important for people to understand that if their pain starts to go up, it may be because there's something going on with their joint. It could also be that these added stressors and anxiety are sort of amplifying some of the pain that they're feeling. One of the things that I would say is we've got a lot of good scientific evidence to suggest that one of the best painkillers is movement, is joint movement. It doesn't have to be loaded. It doesn't have to be the squats and the monster walk that I was just showing. It could just be going for a walk. It could be just moving our joints. One of the big things with osteoarthritis is the part of the joint that gets impacted a lot with osteoarthritis is the cartilage. And the really interesting thing about cartilage is that it doesn't have its own food supply and it doesn't have its own garbage disposal. So most tissues in our bodies have good blood supply, and that blood supply brings in the food and it takes away the garbage, the stuff that's left over. Our cartilage doesn't have its own blood supply. So what happens is it gets its food and it gets rid of its trash through the fluid in the joint being pushed into the cartilage and coming out of the cartilage. And one of the ways, the main way that we get the fluid to go in and out of the cartilage is sort of like a sponge. So when we squeeze it, we squish all the fluid out, all the trash goes out. And then when we unsqueeze it and we relax it, the fluid comes back in and it brings food. And one of the biggest ways that we feed our cartilage is actually through weight bearing. So when we weight bear, we squeeze the sponge, and when we unweight bear, we let the sponge go and the fluid can come in. So movement can go a long way to helping with pain. But I also think doing things like distracting yourself maybe from the pain. So going for a little walk, paying attention to the birds flittering around and seeing how nature isn't as impacted by what's going on as we're being impacted, and taking some solace in that. You know, I think all of that can be very helpful.
Right. Well, thank you so much, Jackie. I wish that that we could talk all day. You have so much wisdom and advice to give to our patient community. Is there any last thing you want to say before we wrap up?
No, I mean, I think the main thing is that just everybody realize that we're all in this together, and that, you know, probably one of the biggest things is that if you are really struggling, you just reach out, whether you reach out on Twitter to a friend or a family member or someone else in our community, you know, just reach out to people. And I think there's enough people that are really looking out for each other right now. And chances are somebody out there will jump in and hopefully be, you know, a little bit of a lifeline or provide a little bit of advice to kind of help you get through that blip that you're going through. So just remember, we're not alone.
Absolutely. We may be physical distancing, but there's still tons of social support. Absolutely. Well, thank you so much, Jackie, for sharing your insight on this topic. And thank you to all of our viewers for watching us at home over Facebook. Please feel free to leave us any feedback that you have from today's video. And don't forget to tune in to our next Arthritis at Home episode for Facts Friday.